The aim of this video is to demonstrate the cardiac assessment, plan, and completing care for the patient, and is to identify medication safety in the preparation and administration of infusion. Just remember the 5 moments of hand hygiene. Clean my hand before entering the patient room. Here is the patient Edward Mason, 85 years old. He was admitted to the hospital cardiac surgical ward 3 days ago following mitral valve replacement. He has type 2 diabetes and suddenly he complained short of breath and palpitations. Make sure I introduce myself and explain about the procedure and reassure the patient. ABCDE approach is to apply when assessing and treating a deteriorating patient. A is airway, is to check patency and check any obstructions in the mouth. B is breathing, check respiratory rate, expansion, effort, breath sounds, and O2 saturations. C is circulation, is to check pulse, capillary refill, and urine output. D is disability, assess conscious level with GCS, and check pupils, measure blood glucose. E is exposure, is to take the temperature, assess the whole patient to look for any evidence of wounds or bruise over the whole body. I will perform the physical assessment for this patient. There are 4 areas of examination of the patient. Firstly, inspection, which is observing. Secondly, palpation, which is feeling with your fingers and palms. Thirdly, percussion, which is tapping over one area for specific sounds. Lastly, auscultation, which is listening to the chest. Especially for the auscultation, there are 4 areas you need to auscultate, namely aortic, pulmonic, tricuspid, and mitral site. After the physical assessment, I need to ask P, Q, R, S, T questions to get more information from the patient for further assessment and care. Firstly, P. P is provocating and precipitating factors. For example, what makes your pain worse? What makes your pain better? Secondly, quality, such as what does your pain feel like? What words would you use to describe your pain? And radiation, does the pain move anywhere? And intensity, on a scale of 0 to 10, 0 is being no pain and 10 being the worst pain, you can imagine how much does it hurt right now. Lastly, timing. When did your pain start? How often does it occur? How long does it last? Based on information from the patient, we need to check his vital signs before and after administration of the medication. Make sure pulse rate has to be used 1 full minute to take because his heart rate is 135, which is irregular. We have to check medication chart to see any prescribed medication and always double check with MIMS as well. The doctor has prescribed 150 mg amiodarone with 100 ml dextrose, which is glucose. You need to take visual before giving the medication because patient has a type 2 diabetes. If the BGL is higher than normal, contact the doctor to discuss. For the preparation, check the amphib's name, dose, and expiry date. According to safety drug calculation formula, stock required 2 ml and stock strength is 150 mg in 2 ml, so patient will have 2 ml amiodarone. During the preparation, I need to comply with non-touch technique. Don't forget to label and document it with second nurse sign. Maintain your hand hygiene prior to IV infusion. Explain about medication includes side effects and expected outcomes. Amiodarone is an antiarrhythmic medication used to treat and prevent a number of types of irregular heart rate. The possible side effects of amiodarone are nausea, vomiting, and dizziness. After you get a consent from the patient, you need to check 6 rights, which are medication, route, time, patient, dosage, and documentation. When you give a medication to the patient, infusion amiodarone to the dextrose bag and connect the catheter to IV cannula and set up the machine properly. Don't forget to put the blue label behind the bag and catheter too. After administration of medication, ask the patient to see the result of medication, side effects, and any other discomforts. Recheck vital signs are required. Nursing education is one of registered nurses' responsibility. I will suggest to him to maintain healthy diet and meal. For example, reduce alcohol consumption, daily exercise, but not heavy lifting for a while, and balanced diet. If he is a smoker, encourage him or introduce smoking cessation program. Ensure regular health screening and visit GP to monitor blood pressure, cholesterol level, and test for his diabetes. To increase health literature, supply on adequate information about his heart disease, such as leaflet or brochure which contain basic knowledge of heart disease and recommended action. Additionally, I can refer him to dietitian and diabetes management program.